This is the first of 3 short presentations that are part of a population health initiative to address health inequalities affecting vulnerable migrants. They provide contextual information, detail some specific challenges, and offer some practical suggestions for practices, admin staff, and clinicians to help reduce health inequalities affecting this group. They accompany a digital resource pack, and all are available to practices via the BSW Training Hub website. In NHS England's plan to reduce healthcare inequalities, vulnerable migrants may be considered one of the plus groups, as a population with poorer than average health access, experience, and/or outcomes, benefiting from a tailored approach to support. Swindon and parts of Wiltshire are places where relatively large numbers of asylum seekers and refugees are moved to following arrival to the UK. Swindon is considered a town of sanctuary that is welcoming to all. Until recently, many asylum seekers and refugees were housed in hotels and cared for primarily by named practices. The removal of asylum seekers and refugees from most of the hotels has resulted in a larger number of people being housed elsewhere in the town and therefore likely to be registering with a wider number of practices. A refugee is defined by the 1951 UN Convention relating to the status of refugees as someone who has fled beyond the borders of their country and is unable or unwilling to return owing to a well-founded fear of being persecuted for reasons of race, religion, nationality, membership of a particular social group, or political opinion. An asylum seeker is a person who has fled their country and made an application in another country to be recognised as a refugee, but who has not yet been granted that status. Some refugees arrive through formal resettlement programmes, for example in recent years from Afghanistan or Ukraine. They may have been given formal support, including help to register with a GP, but may still experience other barriers to good healthcare. Many asylum seekers have travelled for long periods. Some have entered illegally, some may have had a valid UK visa initially, but later be unable or unwilling to return to their country of origin for new reasons. Others may have been trafficked against their will. Another group of vulnerable migrants are those of uncertain migration status, who are not formally asylum seekers and who may have overstayed their visa or simply visited family and stayed. These are invisible patients, difficult to identify, but who will face very similar challenges in accessing healthcare. Refugees and asylum seekers may have experienced great hardship, often fleeing instability and facing long and difficult journeys. Many will have withstood periods of deprivation, with little or no access to healthcare, exposure to threats, violence, abuse or exploitation, and lack of a permanent home. Some will have stayed in camps with overcrowding or poor sanitation. Others may now be homeless. In the UK, asylum seekers are currently not allowed to work, though many want to. All of these things may negatively impact both physical and mental health. All people living in the UK are entitled to access primary care, and proof of address, proof of identification, and proof of residency or visa are not requirements to register. All refugees and asylum seekers with an active application or appeal can access the full range of secondary care services free of charge. Refused asylum seekers in the UK may not necessarily be entitled to free secondary care, as their ability to do so depends on whether the care is immediately necessary or urgent or non-urgent, and whether specific exemptions apply.